fan because she gave us this beautiful fall weather here today. I'm Erie County Executive Mark Poloncarz, and we're here to talk about investments that we've made in the park over the last 10 years and also what we are doing in the future. First off, I just want to note we're joined by a number of individuals here. We have our current Parks Commissioner, Troy Schinzel, who will also be speaking today. We are also joined by former Parks Commissioner, Jim Hornig, who's here on behalf of the Chestnut Ridge Conservancy, so thank you. Once a commissioner, always commissioner, so thank you, Commissioner. We are also joined by the Commissioner, Department of Public Works, Bill Geary, as well as the Director of our office for those with disabilities, Frank Cammarata, and of course we're joined by Karen Gambino, offering the American Sign Language to those who are of hearing disabilities. One of the things that we have that is a tremendous asset for our community is our Erie County's park system. And it has been our pleasure to continue to invest in capital projects throughout the park system for these last 10 years to ensure that these parks, which were created by our ancestors, our predecessors, for everyone to enjoy decades ago and onward, are continued for decades in the future, regardless of whether we're here or not. And one of the things that we often get a lot of questions on is, what are you doing in the parks? What are the investments that are going on? How are you making the parks more friendly for all? And so for the last 12 years, we've had nearly $29 million in projects invested in all of our Erie County parks. And I think it's a testament to the hard work of our park staff and the teams that we have that we collaborate with, that we've been able to do this during this time to ensure that these parks are the best that they possibly can be. I've said it before, parks are never as pretty sometimes as they are the first day they open, because as soon as you have individuals coming and going, it takes wear and tear on the facilities, and you have to constantly upkeep them. But just to give you an idea, in Erie County, as I said, we've done $28,991,022 worth of projects from 2012 through 2022. That includes nearly $8 million in projects here at Chestnut Ridge Park, $7.9 million. And if you, just in this area alone, you can look at a number of the projects that we've done, including the beautiful inclusive playground, the Playground for All, which everyone of all abilities gets to enjoy. We just built a brand new parking lot here, which maybe doesn't seem all that exciting, but we needed to because of the conditions, as well as making the parking facilities ADA compliant. So if an individual is coming either in a wheelchair or they have children in a wheelchair, not only is the playground itself, Americans with Disabilities accessible, compliant, the parking lot is, because what good is it if somebody drives into the parking lot and they have to take their child out in a wheelchair, but the parking lot itself is not compliant? It makes it very difficult for the child to enjoy this wonderful facility. We just completely renovated, actually gutted and rebuilt the bathrooms inside, including creating a family bathroom for the first time ever, which can be used for all ages, including adults, because often we have adults that come here from adult daycare programs that may need a little extra help from some of their aides, and if they're here, we want to be able to provide them the facilities. So we provided, just in this little area alone, you see some major projects that were done in the last 2 years. We previously redid the tennis courts. We relit the tennis courts, first time they've been lit in years. And then, of course, there's all of the other work that's gone on in this park. It's shelters, restroom facilities. All the restroom facilities have been rebuilt or in the process of they're finishing the rebuilding of all the restroom facilities. And that's just an example of one park, $7,928,196. We've spent, as I said, $28.9 million in total in 10 years. That includes $2.6 million at Akron Falls, $1.8 million at Como Lake, $1 million at Ellicott Creek, $2.8 million at Emery Park. And for all of our other parks, and there's lots of other parks that we have, as well as our golf courses and our beaches, $12,768,616. It's just impressive. of what we've been able to do. And I want to thank our partners in the Erie County Legislature for the assistance and support they've had. Our partners with organizations like the Chestnut Ridge Conservancy for assisting us and also fundraising for many of these projects. The idea behind the inclusive playground actually came from the Chestnut Ridge Conservancy, so thank you. Thank you for that. And the nice thing about that is we've seen so much interest in the inclusive playground here that we are expanding inclusive playgrounds to all of our heritage parks. We will be having an inclusive playground at Como Park. We will be having an inclusive playground at Emory, at Ellicott Creek, at Akron Falls, and next year we will be building a second inclusive playground in the lower end, the west end of Chestnut Ridge, to replace one of the older playground facilities that we had down there. This is just another example of how we are investing the people's tax dollars in their parks. It's as simple as that. We like to say we want you to come to your Erie County parks, to find your next adventure in your Erie County parks, because these parks are owned by the people of our county. Just like our national parks are owned by each and every one of us, our Erie County parks are actually your Erie County parks because they're owned by the people of Erie County. There's a lot going on. I'll turn it a little bit over to our Parks Commissioner, Troy Schinzel, to talk a little bit more about some of the projects, but I want to leave you with a number. As I said, we've done, since we've started through 2022, in my administration, $28,991,022 in investments. But we've got a lot more planned. In fact, when you include what we've done, what's ongoing, and what's planned to be done over the next couple of years, it totals $48,494,000. Nearly $49 million of parks investments. It's the greatest dollar investment as a percentage of our budget that Erie County has ever done in the parks since they were first created during the Franklin Roosevelt administration, when these parks were built as part of the Works Progress administration. Some of the parks were here, but a lot of what you see today was invested during those years, during the 1930s. And we're very proud that we were able to increase the investment and put a substantial amount of money in these parks so that children of all ages and abilities will be and enjoy inclusive playgrounds across all of our major parks, but that we're investing in other things. The new restoring the ski hill here, putting in the new magic carpet at Emory Park so more people can enjoy the ski hill there. We're investing in Spraguebrook Park. We're investing in pocket parks. We're investing in pretty much every part unless it's a natural habitat park. And even some of those, we've expanded parking facilities so more people can enjoy them. So with that, I'll turn it over to our Parks Commissioner, talk a little bit more about what's going on. But this is just another example of our dedication and commitment to the people of Erie County that we were going to invest in your parks. We said we would, we have, and there's a lot more coming. I'm very proud of the team that we have here in the Parks Department. They do a tremendous job. And they work hard doing it. So J.J. Thomas, I see our superintendent of the Chestnut Ridge Park and Emory Park as well. Thank you and your staff for the work that you do. Chuck Bartlett, our superintendent for our ranger program, thank you for what the rangers do. They're creating a safer and more educational environment for everyone in our park system. And it just goes to show that if you invest in these assets, these gems, the people will take advantage of them, because you can see behind me. People are playing here, people are walking around, we have a sewing club right there. People want to go to their parks, and I'm very proud of the work that this team has done to ensure that these parks are in great shape. With that, Commissioner.
Thank you. Thank you, Mark. First of all, thank you for coming out today, and as Mark said, the investment Erie County has made and will continue to make in our parks is unbelievable. Mark was a few times mentioned thanking parks and park staff, but I would not be able to go on without thanking Mark, the administration, and his focus and priority that he puts on Erie County parks. It wasn't long after becoming commissioner I knew Mark's passion for the parks. He's always in the parks, always using the parks, always in the parks. So between him approving budgets and Erie County Ledge approving budgets, this almost $49 million has done so much in renovating our park system. I think one of the things I like to talk about today is Mark touched upon some of the projects we've done. A few of the projects we're moving forward with, and that are big ticket items. Most of you may know we have about $5.8 million dedicated to Went Beach, the mansion, and the stable renovation to the Went Estate. Exciting project. We're in some design conceptuals right now with our consultant, but in the next few years, that project's going to be a great lift to that park. We also have about $1 million tied up in the Shank House at Grover, Cleveland, a historic house here in Erie County. We're going to renovate that building and turn it into a historic park system museum type facility. So we're working towards that as well. And then we have over $2 million dedicated in shelter rehabs, major WPA shelter rehabs. Exciting project. We're about 50% design schematics on those projects. Hopefully by the spring of next year, we can break ground on renovating four major shelters in 2 of our park areas, Emery and Ellicott Creek, and rehab those shelters, including improving accessibility and parking to those facilities as well. All of these projects, I will tell you, we would not be able to do without partners. And when I say partners, from the Chestnut Ridge Conservancy and Jim Horning, which you talked about earlier, to Bill Geary and the Commissioner of DPW, to Frank Cammarata and the Office of Disabilities, to DEP, who's not here today. Unbelievable assets. Erie County Parks simply would not be able to accomplish these projects and have the oversight and supervision and experience and skill sets without all those partners. We got great partners, and really that's been a focus of our 2019 master plan, was get good partners and work towards volunteers and partnerships to help elevate our parks to a new level. Friends like the Buffalo Niagara Waterkeeper. Millions of dollars being spent in Erie County Parks because of the Waterkeeper. From Blue Wave funding and access to the river, Chestnut Ridge Conservancy we talked about, but we got Lancaster Unleashed, our friends group at Como Park. We got the Friends of Ellicott Creek Park, our friends group for the dog park at Ellicott Creek. So we have a lot of friends groups, and they really make a difference. So exciting at the future. We got a lot of projects in the burner to say, and we're excited about the future and where we're heading. And I think a little bit we're going to talk. Frank Cammarata from the Office of Disabilities is going to come up and talk about accessibility and some of the things we've really worked with his office on, and thanking Frank, on improving our overall parks, but not only our parks, but inclusive and accessibility to those park areas.
Thanks, Troy.
Absolutely.
Good morning, everybody. I think Troy stated it well, the county executive stated it well, but I really have to thank both of them for focusing on accessibility. And it's not just about the accessibility, it's really about inclusion, because the parks, as the county executive mentioned, are for everybody. And the work that Troy and his folks are doing is work for everybody. I'll give you a quick little story. About a month or so ago, Troy and I were talking about the fishing pier just down the road here, and I mentioned to him, I think that what we need to do is we need to just cut a couple pieces off and enable people who use mobility devices to be able to go out there and cast a line in. What did he do? Literally, a week later, he and his staff went out there, cut that piece of wood, and created an accessible fishing area for people with disabilities, for people who use mobility devices. I mean, that's just the kind of responsiveness that we're getting from the Parks Department, from the county executive, etc. So I couldn't say any greater thank yous for all that they're doing. So thanks. Yeah.
Thank you, Frank. To give you an example of what this means, I was at the Pulaski Parade this past weekend, and there was a gentleman there with 3 children, and this was afterwards at the Pulaski Festival, and there were 2 young girls, and he had one of his young son, and his young son was in a wheelchair, and he told me about how much they love Chestnut Ridge Park's inclusive playground, and that how his son, when he goes and sees a playground that does not have inclusive features, gets kind of upset, saying, why aren't these at every other playground? Well, that is a good question. It's something that we're working on to try to bring inclusivity in these playgrounds to all of our parks, and in the long run, hopefully every playground that we have will eventually be there. And it just goes to show the impact when a little boy who looked like he was probably, 4 or 5 years old, is already asking questions that we should have asked ourselves for many years. But we're moving on it because we know it's better for the future. Just another example of the investments. These things are not cheap. People ask, well, why do you do them? We do them because they're right. It's not the cost that matters, it's the right thing that matters. These projects are not inexpensive. Project to do a road is not inexpensive. Just ask our Department of Public Works Commissioner. The cost associated with doing roads and parking lots has increased tremendously as the cost of oil has gone up. But we do them to create better enjoyment for each and every one of the individuals who comes there, regardless of their abilities. And that's what we're going to continue to do going forward. With that, I'd open up to any questions you have on topic. Yes.
Yeah, I have two questions if that's okay. My first would be, one of the challenges where we live is the climate. We have hot summers and we have extremely cold winters, and I know those can be hard on sidewalks and concretes, and it just impacts the maintenance cost of any outdoor accessibility feature. So I'm wondering what the upkeep of these playgrounds and the maintenance is going to look like over the years, ensuring that they'll remain accessible and the parking lots as well.
Well, I'll turn that over to the commissioner with regards to maintenance of the playgrounds. The one thing I will note, especially with roads and things like that, is they do degrade over time and you have to repair them. So that's one of the reasons why we did that major work that we did in the parking lot out here, is because the former parking lot, which wasn't bad when it was first opened, degraded. But not only did we just repave it, but we created a more ADA compliant facility as well. But I'll turn it over to the Parks Commissioner to talk about how we're going to maintain this during the winter months.
Sure. Thank you, Mark. It's a valid point. I think Park 101 is you don't build it if you can't maintain it, right? And you mentioned with the climate change, not so much here at Chestnut and not so much at our other park areas. Maintaining the playground will just be like maintaining other playground. Honestly, easier in some ways. It's a poured in place material on top, so there's not wood chips that get blown all over. So it might be easier to maintain in that regard. But we are feeling the results of the climate change along the shoreline. Times Beach, Bennett Beach, Went Beach, shoreline erosion, those are concerns, legitimate concerns, right? We just talked about maybe investing up to $6 million in Went Beach, and we have a shoreline that's eroding. So those are concerns. We're working with our Office of DEP, we're working with the Army Corps of Engineers, and looking at ways to start to not only study those, but combat some of those issues with our coastal resiliency in our park areas.
Thank you, that's helpful.
Sure.
I just know there'd be parents wondering, like, this is great that we have it and it's new, but making sure that over time it's going to last. And my second question, and this is probably more of a question for Frank or Mark, but, or anyone really, but one of the concerns that was brought up to me by a parent with these accessible playgrounds is that they're not fenced in. Mm-hmm. And I think some parents prefer fenced-in playgrounds. They prefer to know their child isn't going to run down this hill, try and run into the woods. To have that enclosed, safe play space. Are any of these new inclusive playgrounds going to be fenced in, and what went into the decision making? And can parents still provide comment on what they'd like to see?
Sure, I could speak to that, and then Frank can add a little bit. But we discussed that with our first playground here, but we did take additional steps here, and you can see that here at this one. There's a fence along the back area, and there's also a wildflower area which we grow so the grasses grow up a little taller to limit that possibility along that ravine. But they're also not dog parks that are fenced in. We are very aware of that. They're typically in places in the park, in the middle of the park, but when spaced out with access centralized to the heart of the park area. So something we certainly discussed, and there's other ways than the design we can encourage children and to stay at the playground itself. Frank, I don't know if you had anything else to say.
I think you said it.
Yeah.
Because it was discussed.
Yeah, it was discussed, certainly.
One of the issues that you have in government is you're never going to be able to satisfy 100% of the people. It's as simple as that. We want this to be a welcoming environment so that individuals can come in from that side of the park, this side of the park, the other side of the park, the parking lot, and it was discussed. It's just unfortunate that you're never going to be able to provide a 100% secure environment. Even if you put a fence in there, that does not prevent a child from potentially getting injured. Kids trying to climb the fence, getting injured climbing fences. So the one thing that we realize when we go through these projects is we want to ensure that the projects are going to be used, they're welcoming, but that they're safe. And just even alone having a fence, sometimes we see it over here with regards to the fence on the side. One of the biggest problems are the kids that start climbing them. Then the next thing you know, they cut their leg, and then the parent is suing us because their kid climbed a fence that we had and cut their leg. And trust me, we get a lot of lawsuits with regards to issues that happen at our facilities. So I would just note that we try to take into account the vast majority we take into account everything, but we're not going to be able to meet every single request because it's just, you're never going to be able to keep everyone 100% satisfied. I learned that a long time ago when I entered this business, that there's always going to be some critique about what you do. You just try to do what's best you feel for the greater good of all.
Absolutely, thank you. I just want to be able to give more perspective on that.
Sure.
And is there any way that parents can provide feedback to these new playground designs before they're built?
Well, the
Kinda set in stone?
the designs are set. They're in process. But what I would note is that we're not just doing this on our own. We're working with an architectural firm and an consulting firm that this is all they do. And if you want to talk about architects and the others, this is what they do. So it is not as if the information is being done by a party who's never dealt with these issues before. And I think that's important so people understand that the design elements that are being taken into account are those that are in park solely, and it's not just something that we're just kind of plopping down.
Yeah, and honestly, the public input and Frank's input on the Office of Disabilities were instrumental to this playground here. So what we did is we just copy and pasted that, and we're just doing it on a mini scale at those other park areas. So certainly the input on how to access and the best with Parkitects, who is our vendor, very renowned for inclusive playgrounds. They were the vendor for this one, so we're worked with them, and just on a smaller scale at each of those areas. And a second one here at Chestnut, we use some of those same things that have been tremendously successful here to piggyback in those other areas as well. And I did want to mention there is a fence against the ravine, and there's a secondary fence here, so we are taking every step we possibly can to make it a safe environment.
Absolutely, thank you
Please.
so much.
Sure, of course.
So during the pandemic, we saw an increase in parents and kids come out. Can you talk about what you expect that to be moving forward? Maybe any statistics that you have?
Yeah, we don't have numbers, but I can tell you we expect it to be the norm, right? I think what we've seen, and my guesstimate would be a probably 30% increase in park use, right? Where was the county executive and where was the governor telling people to go? Go to your parks, and because of that, we had to pivot and change, and we did that, and we are still doing that. Honestly, a lot of our conservation areas like Hunters Creek and 18 Mile, those areas, we had to create second parking lots, and we had to deal with some maybe damage and things we haven't had to deal with because they were hidden gems. But that's okay, right? But we want users, so we've absolutely experienced an uptick in not only recreational use but passive use. And we've kind of had to pivot and change our operation a little bit about that, including our budgets, just to accommodate the increasing use. Yeah, absolutely.
Any other on
Any
topic?
questions?
I'll take some off topic just briefly.
Mark, I know that there's going to be the strike vote that they're going to be counting later on tonight for Cammarata Health. Just how concerned are you that the workers with Cammarata Health and the unions are going to be going on strike?
Well, we're exceptionally concerned. For those who didn't hear the question, if you're watching live, it was in regards to the strike vote. We expect the strike vote to be an authorization to strike. We know that the unions, CWA and SEIU, have been negotiating in good faith as long as with Cammarata, but they're far apart. Our Department of Health had pretty much an emergency meeting with Cammarata representatives. We've been keeping in touch with both. I'm concerned because of the impact it'll have on healthcare in our community. I understand the concerns of the representatives of the unions as well as the workers. They do deserve to be receiving appropriate pay and other types of additional assistance. We are working behind the scenes with our partners in healthcare to ensure that this does not impact our healthcare system to the point where people are not receiving care. But it's going to be very difficult if it goes on strike. And we are continuing to have conversations with our partners. No one wants to see a strike. We know that right now there is a very big strike going on, I believe, in Wisconsin and Minnesota, which is not good for those communities, is what I'm hearing. And I'm not so certain that if there is a strike authorization and all the hospitals go on strike, they're going to be able to continue in any type of current capability. We do know that Cammarata Health has a plan which would unfortunately require moving patients out of our area, that they'd have to be moved to Rochester, Pittsburgh, Cleveland, Erie, because of the huge amount of service that Calida Health provides for our region. So we're continuing to have those conversations. I'm hopeful that a strike will be averted. I do expect a strike authorization to be approved during the vote, and that does not mean they will go on strike today or tomorrow, but it would mean that a strike could be very imminent. And I think our goal is just to ensure that a resolution is attained in which it's beneficial for all. It's beneficial for the employees, it's beneficial for Calida, but just as importantly, it's beneficial for the people of Erie County and Western New York who rely on Calida facilities for their healthcare needs.
Sorry, Mark. We saw the strike almost a year ago already with Catholic Health, and at times over that 5-week period, things got a little ugly during the negotiations. Is there concern that it could get just as ugly or even more ugly, especially since Calida is a much more broader network of hospitals in Western New York?
Well, I will note that there does not seem to be the acrimonious nature between labor and management as there was in the Catholic Health strike. They are bargaining all in good faith. They're just far apart on the dollar figures. I think they understand where each party wants to be and needs to be. I don't believe Calida has the financial capability at this time to meeting those demands. But it is not acrimonious, thankfully. That doesn't mean that we are not looking at a strike. They are looking at a strike. I am very concerned because this is going to have an impact. And our concern is if somebody's having a heart attack, okay, the ambulance service will be able to respond, but where are they going to take that individual? Someone has a stroke. If someone has much needed surgery that now has to be delayed, where are those individuals going to go? Because the last thing we want to see is a death of a resident that could have been avoided if the strike hadn't been in effect. So we're continuing to talk. Actually, I'm hoping to talk with the leaders of Calida either later today or tomorrow morning. And same thing with our friends in labor. But it's nice to see at least the acrimonious nature of what happened last year is not occurring this year. But if you talk to everybody associated with the CWA and Catholic Health, you'll get a different response from even individuals in the union as to whether or not they felt it was worth it because of how long the strike went on, the impact it had on their families. I know for Catholic Health, they spent hundreds of millions of dollars more than they probably needed to if the thing had been resolved beforehand. It's healthcare healthcare in the United States is a broken system. It is only going to get worse. Costs are skyrocketing. You see it with regards to the issue associated with traveling nurses. Traveling nurses are coming into hospitals and making 3 or 4 times more than the nurses that are the full-timers that work there. And it just can't continue. But if it does continue, every hospital in the United States is facing this. Every nursing home, every facility that relies on these traveling nurses because they're driving costs up. People should be paid a good wage. I'm not saying that they shouldn't be paid a good wage, but it's getting to a point now where it is, we knew there were problems in our healthcare system and the cost associated with healthcare was skyrocketing, but it's getting even worse. And it's not necessarily being driven by inflation. These are issues that are more result of the pandemic and post-pandemic issues. So we are very concerned, and we're going to continue those conversations, and hopefully a strike can be averted. If a strike is not averted, the Erie County Department of Health stands ready to do what we can to ensure that health care in our region continues at a high quality, but that also may require people being moved. Instead of, if you're having a heart attack in Clarence or Amherst, you're probably going to Millard, Fillmore, Suburban. You might find yourself going to Rochester in Monroe County because that might be the closest hospital that has a bed available to be able to take care of you, and that is not something that I find good for our region.
Well, on that same topic of emergency care, if the strike does happen, is there an urgency to resolve it before we get too far into winter? Because I know that, we're not seeing as many deaths or hospitalizations with COVID, but it's still a season where we have the flu, we now have monkeypox, we have COVID. There's still people getting infected with these viral illnesses in the winter and getting sick and needing hospital care and emergency care.
Well, I would say the urgency is the urgency of now. It really doesn't matter if it's summer, spring, fall, or winter. We do not want to have a strike at our major hospital system because of the impact it'll have on all matters. We are entering a more viral load season. There's no doubt about that. There will be more flu, of course. Hopefully not as much COVID, especially now that we have the new reformulated vaccine booster that's available. There's no good time for this. There really is no good time. It doesn't matter what time of year it is because people will be affected by a strike if it does occur.
Mark, I know that you can't necessarily get into the specific details about certain aspects of the negotiations with the bill stating. Could you just give us an update in terms of where the process is, especially now that this 45-day period is already underway and we've got exactly 1 month to go until this new deadline of October 15th?
I'm not going to get into particulars other than to say that the parties are still communicating and talking. That's how it goes in this business.
Any concerns that this could get a little dicey once it gets closer to this deadline? I know that there was talk that there was good things happening before the September 1st deadline. Now this extra deadline is coming.
Well, I have to admit, right now, the concern of the administration and our partners in the Erie County Medical Services Division of the Department of Health, the Department of Public Works, is ensuring that everyone has a safe and fun environment on Monday night. We know people are really excited for this game. We are very concerned about the amount of alcohol that's going to be consumed by individuals pre-game and the level of intoxication. I just want to remind everybody, have a good time, but the police and sheriffs will be on the road, so if you're drinking and driving, you're going to get arrested, especially as you leave the facility. And too often people unfortunately consume alcohol to a level where they are not even capable of making it into the facility to watch the game. So right now that's our prime concern, is getting through this, what's going to be just a crazy environment. We have this incredible team. It's the home opener on Monday night against a really good team, Tennessee, and right now that's what we're working on, at least through this weekend. Okay, everyone, thank you.